What about diagnosis of kidney disease then? We may make a diagnosis once clinical signs have become present and once they are obvious. Ideally, we want to diagnose it earlier than that. If a cat is being seen once or twice a year for regular examinations as that cat gets older, that gives us an opportunity for earlier diagnosis. We may be able to tell, for example, that the cat is gradually losing weight. But by doing some simple tests, for example, collecting a urine sample once a year or twice a year, looking at the urine-specific gravity, which is a measure of how concentrated the urine is, or looking at the amount of protein that's being lost in the urine, those may be early indicators of kidney damage. So may allow us to make a diagnosis at an early stage. If we want to make a specific diagnosis, we would normally combine that with some blood tests that would look at things like urea, creatinine, or SDMA. These are blood markers that tell us about the function of the kidneys. Along with that, we would also be looking for other complications, so things like hypertension, monitoring blood pressure on a regular basis. If we find a cat that has a high blood pressure, that may be an indicator that there could be underlying chronic kidney disease, for example. So making an earlier diagnosis allows for earlier intervention, allows us to slow down progression of disease, maintain quality of life. So diagnosing CKD is based on a number of different factors. It's based on clinical examination, it's based on clinical signs that may develop, but it's also importantly based on urinalysis and blood samples. These allow that early diagnosis of CKD. But it's not only just making a diagnosis of chronic kidney disease that's important. We need to diagnose this disease, but also by doing these investigations, by doing the urinalysis, by some blood tests, by monitoring blood pressure, we can stage the chronic kidney disease. We can tell how far advanced the chronic kidney disease is. Also, we can monitor progression over time to see how the disease is developing. That gives us a better idea of prognosis for the individual cat. And also, by doing these investigations, we can see what complications may be arising from chronic kidney disease.